All right, let's talk about benzodiazepines. You probably heard of some of them, like Valium or Xanax. They're this whole class of drugs that a ton of people know of, but very few people really get. They're an incredibly powerful tool for anxiety, but as you're about to see, it's a complicated story.
I want you to imagine for a second that your brain has a volume knob for anxiety. What if, when things got too loud, you could just reach up and turn it down? That's really the core promise of these drugs. And that promise, well, it speaks to a very deep, very human desire for a little peace and quiet inside our own heads.
And we're not talking about a small problem here. In the United States alone, 40 million adults are dealing with anxiety disorders. This isn't some niche issue. It's one of the biggest challenges in modern mental health, period.
So you have to remember, before benzodiazepines showed up in the 1960s, the main option on the table was barbiturates. And yeah, they worked, but they were kind of like using a sledgehammer for a finishing nail. Super high risk of overdose. So when benzos came along, they were hailed as this revolutionary breakthrough, a much, much safer and more targeted way to get that calming effect.
So how in the world do they actually work? Well, this is the fascinating part. It's all about amplifying a signal that your brain already uses to calm itself down. Benzodiazepines don't just invent some new off switch. They just find the one you already have and make it way more powerful.
And the star of this show is a neurotransmitter called GABA. The easiest way to think about GABA is as the brain's main brake pedal. When GABA latches onto a neuron, it basically tells it, hey, slow down, fire less. And that experience, for you, is a feeling of calm.
And here is the absolute key. Benzodiazepines are what we call modulators. They don't really do anything on their own. Instead, they grab onto that GABA receptor and make it super sensitive to the GABA that's already floating around. So they're not adding new brakes to the system, they're just making your existing brakes work a whole lot better. Okay, this is just a fantastic analogy from Dr. Najib that really explains the safety difference. He says that the old-school barbiturates were dangerous because they would prop the calming channel wide open, like holding a mouth open permanently. Benzodiazepines are so much safer because they don't do that. They just increase the frequency, how often that channel opens and closes. It's a really subtle difference, but it's a life-saving one.
But here's the thing. Benzodiazepines are a really broad category. Not all benzos are created equal. The real difference between them all comes down to speed and how long they decide to stick around in your body.
We can pretty much group them into 3 main buckets based on their half-life. And that's just a fancy term for how long it takes for half the drug to get cleared out of your system. You've got your short-acting ones that are gone in a few hours. Intermediate ones, like Xanax, hang around for a day or two. And then you have the long-acting ones, like Valium, that can linger for several days. Now, trying to memorize these names is, well, it's basically impossible. So medical students have come up with some pretty clever tricks. For the long-acting ones, there's this very strange, kind of morbid story. Tim wants to clone himself, so he goes to his closet and drinks chlorine, gets flu-like symptoms, and dies. It's weird, I know, but as you can see, each word is a clever hook for a different drug name. Thankfully, the trick for the intermediate-acting drugs is way, way simpler. You just have to remember the word allo. A for alprazolam, L for lorazepam, O for oxazepam, and so on. A little easier to remember than the story about Tim, right? Now, knowing the names and the speeds is important, but that only tells half the story. Because up to this point, these things sound like miracle drugs, don't they? But this is where the story takes a really sharp and serious turn. The very thing that makes them so effective, that volume knob, is what makes them so incredibly risky over the long haul. And look, this isn't some fringe theory. The American Psychiatric Association is crystal clear about this. With ongoing use, physical dependence isn't just a possibility. For most people, it's an inevitability. Your body just gets used to it being there. It adapts. And let's be super clear here. We're not talking about abuse or addiction in the way people usually mean it. This is physiological dependence. It's your body's natural adaptation. In fact, more than half of all patients who take a benzodiazepine for just over a month will develop it, even if they're following their doctor's instructions to the letter. And this dependence has had tragic, real-world consequences. Just look at this chart. It shows overdose deaths where benzodiazepines were involved, which often means they were mixed with things like opioids or alcohol. The numbers are just staggering. a more than 10-fold increase in less than 20 years, from just over 1,000 deaths to over 11,000.
And this slide really gets to the heart of why stopping can be so incredibly hard. The withdrawal symptoms are like a cruel mirror image of why people started taking them in the first place. You get this intense rebound anxiety, terrible insomnia, on top of all this other awful stuff. In the most severe cases, withdrawal can be life-threatening and even lead to seizures.
So what's the solution? What do we do with this information? Well, the goal isn't to demonize these drugs. They can be incredibly helpful and even life-saving. The key is to understand their proper role and to know what the other, safer, long-term options actually are. The medical consensus on this is really clear. Benzodiazepines are for short-term, acute situations. We're talking about things like a severe panic attack or getting through a scary medical procedure. That's where they shine. The recommended window for using them is just 2 to 4 weeks. For long-term, chronic anxiety, the go-to treatments look totally different. As you can see here, medications like SSRIs work on a completely different system in the brain, serotonin. Now, they're not a quick fix at all. They can take weeks to start working, which makes them useless for a panic attack happening right now. But, and this is the big but, they have a much, much lower risk of dependence, which makes them the safer, more sustainable choice for managing anxiety day in and day out.
So it all comes back to this one question. Are they a powerful tool or are they a dangerous crutch? And the answer, really, is that they're both. In a moment of crisis, they can absolutely be a lifesaver. But when that short-term tool becomes a long-term habit, it can become a trap. It's an incredibly fine line between help and harm, and it really demands a deep respect for the power of these medicines.